Hey, we've got a special episode today on Your Retirement Elevated. We're going to be talking about Medicare plans, and it is really important that you review your medical plans like as soon as possible because big changes are coming to the industry and you don't want to be caught off guard. We've got a special guest to join Scott on today's show. We're going to dive all into it today so that you're well prepared for these big changes coming down the pike.
Let us help you reach your peak in retirement. It's time for Your Retirement Elevated.
Your Retirement Elevated back again. Walter Storholt with you alongside Scott Dugan. And we've got a great show today as we're talking about Medicare changes, Medicare plans that you need to review, Medicare Advantage plans. This includes that as well. We're going to go over as many of the changes as we can on the show today and point out to you some of the areas where you've got to pay attention and where you're going to want to make some changes or at least review your situation heading into 2025 and beyond. As always, Scott Dugan is here. Scott, this is a really important topic for you and your clients and people that you're working with on a daily basis. And we've brought an insurance and Medicare specialist along as well to help kind of fill us in on all the information that we need to know today.
It's going to be a great show. And we've been planning this. We've been hearing a lot more from our clients, a lot more questions about, hey, I'm hearing this, I'm reading this. And so let's get Cortney Dale scheduled because she is the expert on the subject. And we've been working with her and her team for a long time now, and she actually takes care of a lot of our clients. And so, and also has some exciting news about the proximity to where she is to us now. So that's going to be exciting. But yeah, very excited to have Cortney on the show today.
Well, Cortney, let's introduce you to everybody. Cortney Dale, everybody. And we can't wait for your expertise and what you have to share with us today.
Well, thanks for having me. And the biggest exciting news and the big difference that's changed since the last time I've been here with Scott and the Elevated Group is I have relocated. So I'm even closer to the office. I'll be in the office 2 or 3 days a week, probably more than that when annual election period rolls around. But yes, I'm here now. So not just virtually, physically in the Kansas City area. So that has been exciting and definitely new.
Congrats on the move. So glad to hear it. Well, Scott, I know that you're working with clients each and every day, and we've got kind of big news coming down the pike right now with all these Medicare changes. So why is this such an important piece of the puzzle for anybody preparing for retirement to help us set the stage for what Cortney's got in store for us?
Well, if you've been listening to the show or been a client of ours for a while, you know that we talk about the 5 key areas of planning, and healthcare is one of those crucial, critical pieces that we want to make sure we've got a good plan in place. And really, that healthcare revolves around what do you do for health insurance pre-65? What do you do 65 and beyond, which that's Medicare, Supplement, Advantage, Part D, prescription drug, all that package of things. And it's also talking about long-term care. And today we're going to let Cortney, because she is the expert, really talk about the impact of the Inflation Reduction Act of 2022. That is coming to roost in 2025. A lot of changes are going to take place. And again, I hear some rumblings about it in the market, but I don't think people are prepared for what's coming, especially in the Kansas City market. And we won't get specific today about companies, but we're going to talk about some numbers of people that are going to potentially be affected by the changes. So definitely excited to turn that over to Cortney and let her go through the details.
So as Scott said, the cause of all of this, and we are by no means trying to create fear in an already scary situation, because a lot of you that are brand new to Medicare or getting ready to turn 65 and know nothing about Medicare, it can be very overwhelming and very confusing. But the reality of the situation with January 1 of 2025 is when these changes, they come to fruition from the Inflation Reduction Act of 2022. That's when we start to really see the drastic changes. And when I say drastic, of course, I'm talking about costs and out of pocket, because that's what we're all concerned about. That's what can really chip away at our nest egg, put a dent in our retirement, because sometimes it can even delay a retirement without proper planning, because you do have to cover those out-of-pocket costs, and we don't want that to happen. So again, we're not trying to create fear by any means, but planning and preparing and having someone review your plans is going to be crucial this year more than ever. Again, the Inflation Reduction Act was created and passed to help with some of these ridiculous pharmaceutical costs. And they did, things were getting out of hand for a long time. And I'm not saying that has all gone away, but we are seeing changes in a positive direction on some things. They're going in a different direction on the other things. So we wanted to kind of give you some education on why this is happening now, why 2025, and what caused the cause for concern right now. So that is, again, the cause of it. Now, the next part is what are those changes, and what do those changes look like, and how is that going to affect me? If you've been on Medicare or know anything about Medicare, helped, a spouse or a parent or anyone, about the donut hole. Well, I always joke that, donuts are one of my favorite treats. So this kind of, when I started working in the Medicare space, donut hole is no longer a happy term, because what happens there is when somebody falls into the donut hole, they have a coverage gap, meaning their insurance covers less and they pay more at the pharmacy. Well, thanks to the Inflation Reduction Act, this is one of the positive things that's come out of it. It is gone. The donut hole is gone. So no one can ever fall into that gap. With that, they've also implemented an annual out-of-pocket cap. So the most that a person can pay out of pocket, this is not retail costs, this is not anything other than a beneficiary's costs at the pharmacy on copays for medications, cannot exceed $2,000. So if you are on mostly generics, or hopefully you're lucky enough that you're not on any, that $2,000 seems like I'll never reach that. One drug, one expensive blood thinner can cap you out in a hurry. So that is a good thing for a lot of people that are on expensive drugs. You don't have to do anything to qualify for that. That is just now implemented starting January 1 of 2025. So this is the kind of how the Part D phases are going to go. Now that they've taken out the donut hole, that's gone. So it's just the deductible phase, meaning you pay everything until your deductible is met. Then it goes into the initial coverage phase. You pay a portion, and then catastrophic, you pay nothing after that $2,000 has been met. Another big thing, starting January 1 of 2025, a Medicare prescription drug payment plan. So if you are someone who has high cost drugs, now there's all kinds of qualifications that you will have to meet to get the payment plan, but it is there and it is going to help a lot of people. So that's also new. Credible coverage when on group coverage. This is another thing, especially those that are still working. We need to pay close attention to this. Things are changing drastically with group coverage, meaning it can be less. If it is not equal or better than a Medicare Part D prescription plan, then it's basically not recognizable as coverage at all, and that could cause you a late enrollment penalty later on in life. So that's all of the credible coverage criteria has changed for 2025 when it comes to group coverage. If you are on group coverage, employers are required to give a notice of credible coverage to all Medicare eligible individuals who are applying for or enrolled in the plan. If you've received this for 2024, it is likely that you will also receive it for 2025. But if this is you and you are on a group plan and you haven't seen this yet, or you're not sure, make sure, if you are one of those people that is delaying your coverage, delaying your Medicare, and going to continue working past the age of 65, we really need to be paying attention to this because the guidelines will change. So in essence, there isn't a lot of action you need to do. Most of these things will be just kind of implemented when you choose your prescription drug plan. But I cannot stress enough that if you are already on Medicare and you're thinking, hey, I'm hardly paying any costs at all. I don't need to really do anything. Why would I change anything? What is a zero copay drug now could be, we don't know what it's going to be. What is also happening is these carriers are eliminating plans. So the plan you're on right now, who knows if it's even offered in 2025. So if you do nothing, then what happens is their cheapest plan, which could be 3 times what you're paying now, you're just automatically going to be enrolled into that plan, and then you are stuck on that plan for 12 months. So again, we can't stress enough that this year is more important than ever to have those plans reviewed.
And Cortney, on the, talking about, notification. Now on the credible coverage, obviously you get notified, by the insurer, I assume, or the employer. With this, what you're saying is really you've got to take it upon yourself. If you are on a plan, you've got to find out, is your plan going to stay intact? Is your carrier going to stay in the market? And do the carriers that are exiting the market or dropping plans, when do they have to notify individuals that it's happening?
Those letters are going to be coming out within the next 2 weeks.
Okay.
So if you
Gotcha.
haven't received one, I know that some carriers have already sent them out.
Okay.
But there is a carrier in the Kansas City metro area that is eliminating, just completely removing themselves from the market,
Yep.
which is leaving 34,000 people in Kansas City having to get a different plan.
Yep. And when you told me, I'm going to say that number again, 34,000 people in the Kansas City area are going to have to do something different to take action.
Yes, you have no choice. If that's you and you are on this plan and it is a very well-known carrier, and if you haven't received the letter yet, you probably will. You do not have a choice. You have to choose a different plan.
Yep. And then people are left to their own devices to go out to shop, to research, to find out what their options are. Is that, I think, what a lot of people are going to be faced unless they've got a trusted source that can help guide them through that process, look at all the possibilities they have for coverage in their situation. Without that trusted source, they're on their own. Is that correct?
Correct. And I get asked this question all the time, and I'm sure you do as well. When you're an independent in the insurance and financial services industry, you have access to multiple carriers and multiple products. We're not just working for one particular carrier. So I get asked this question all the time: what's the benefit of having my plan reviewed by you? I could just go out and do this on my own. You would literally, and especially when we're talking about Medicare Advantage and the prescription drug plans, you literally have to plug in every single drug. You have to go and side by side compare every single plan out there. You would have to look at deductible versus deductible, copay versus copay. How does each drug fit onto the formulary of each particular plan? Is my drug a tier 1 on this plan, but it's a tier 2 on this plan? And again, not trying to create confusion, it's just really confusing. So when you're working with a professional, we can look at all of them for you very quickly and efficiently. We can tell you what's the best fit for you, your lifestyle, your current situation. We have a series of questions that we would ask. There's all kinds of things that go into this, and when you're deciding a plan, we would ask you all those questions and kind of steer you in the right direction in about 30 to 45 minutes versus you having to go out and research every single plan, compare them to each other, lots of different bells and whistles, especially on an Advantage plan, compare pricing, compare copays, compare deductibles, on the drug costs, compare copays, compare coverage levels, tiers, formularies. I just don't know anyone who wants to spend their time doing that.
Right.
So, and that's essentially what you have to do. And we all have the same pricing, so working with us or going directly to the carrier to purchase your plan or enroll in your plan isn't saving any money.
So what you're saying is you can get a guide to walk you through this process, gain back quite a bit of time of research and headache, spend 30 to 45 minutes, walk through you and your team's proven process to filter down what the handful of options are. and not have to stress about it, not have to go through that entire process. And I can tell you that, I've got a lot of very bright advisors on our team. And as we've gone over the years where we've got, chief investment counsel, a group of CFAs that handle the investment side of things. We've got attorneys that focus on estate planning only. They don't fix parking tickets. They don't do divorces. They do estate planning. We have a CPA. We do tax preparation, because I believe that there's not one person, one advisor that can do everything. Now, they may have a broad understanding of a lot of the areas, the 5 key areas, but we've really taken this, have a specialist to heart. And that's where having Cortney, and especially her team backing her up, having her as a resource for not only our clients, but just, potentially the thousands of people in Kansas City that are going to need help and guidance, to get through this. And so we're very fortunate to do that. So I think it's smart, and it's to spend 30 to 45 minutes. And, we're putting this out there. Obviously, this goes to all of our clients, and we take care of this, or Cortney, you take care of this for a lot of our clients. I would tell them, and I think you would urge them too, is to reach out, set a time to chat, get an appointment on the books, mark out your 30 to 45 minutes, because I believe that there's going to be a tidal wave of people needing help here very, very soon. Would you agree with that?
I agree. We are already, I joke about it, how in the retail stores like Hobby Lobby and things like that, it's like every year it gets earlier and earlier. Christmas stuff is out. It's like we get done with Easter and Christmas is out. And it's the same way in Medicare. It used to be, we didn't talk about the annual election period until it was here, which, by the way, is October 15th through December 7th, is the only window that you have to make changes on a prescription drug plan or Medicare Advantage. So if you don't make a change during that window, you are just stuck on the plan that you are already on. But it's happening earlier and earlier and earlier. The advertisements are coming out. Our buddy Joe Namath is coming on TV. He's already on there right now, because they know that this year is going to be worse than any other year. And we've got to get the education in front of you before it's too late. And that's kind of what we're trying to do right now. And there's lots of times that we sit down with someone and you're exactly where you need to be. But it's also nice to just have that peace of mind. So maybe we don't make any changes, but we still need to look at it to make sure that you're right where you need to be. And that was, a lot of people didn't make changes. I have a lot of people tell me, oh, I have it looked at every few years or so. Unfortunately, the industry's changing, the landscape's changing on how these plans are structured, and we can't do that anymore. You can end up incurring significant costs that were completely unnecessary just because you didn't make a change. So it is worth it. Even if it's just your time, it's worth it, because again, you would have to do a lot of research, a lot of data entry, a lot of unnecessary things on your end to get results that you may still not understand. So we want to provide some clarity and some education on what's going on and move you in the right direction.
Right. I think that's why we're putting this out there. Obviously, it's the first third of September as we're recording this. We wanted to get this out there, and just want to make sure everybody understands, because you did a great job of framing this. You said it's October 15th through December
7th.
And
we will be doing in-person reviews at the Elevated office on several dates. October, we cannot see plans for next year until October 1st. We can't actually submit applications until October 15th. But we have several dates on the calendar just dedicated to Medicare reviews. So if you are someone that's listening today and you think, oh, I don't know if I have time, or we still have plenty of dates and times. Again, I'm here now So it's not as prohibitive on scheduling as it used to be when it was all virtual. We can still do virtual. We can do Zoom. We can do a phone appointment. You don't have to come to the office. So any of those things we need, we need a couple documents signed in advance, and we do need an updated list of your prescriptions. But other than that, that's all that's required. It's a pretty easy, we try to make it as simple as easy as possible.
Gotcha. And it sounds like if getting on your schedule sooner rather than later, even if they download the information to you and get everything lined up, at least they're in the queue. And when the time comes to be able to evaluate the opportunities that are there, then it could be a quick phone call, say, hey, here's what we looked at. Here's what you should look at doing. And then if it's a green light, then it's just paperwork. And that way you're not waiting until you're right at the date. So I would say time is of the essence, getting on the calendar sooner rather than later, and just being prepared with all this. So, and I think we're going to be putting out a little more information as it gets closer, because I think we're starting our strategic planning meetings, the latter part of the year. And that's probably going to be a point of conversation. And so I know Cortney will be able to give us more detail, but hopefully educate people on the front end. And so it's a good, efficient conversation, and we can get them good results very, very quickly.
And like we talk about this with everything, the biggest risk is not doing anything. Mm-hmm. So it's a complimentary consultation. It's not going to cost you anything. There's no charge. It will cost you about 30 to 45 minutes of your time, but you'll gain a lot of value in just that 30, 45 minutes. You'll either, move to a better plan with better coverage and save money on your healthcare costs, or you will get the peace of mind knowing that you are right where you need to be.
Definitely. You can check that box and move into the holiday season not having to worry.
Exactly. October 15th through December 7th is the only window that you have to make a change for 2025. So we can, and everything is electronic. It's not a bunch of paperwork and things like that. I get that question a lot. What do I have to do? Is it a bunch of paper? Everything's electronic, just like everything else in the world. Everything's electronic.
For better or worse.
Yeah. Yes. Not a lot to it.
Well, as we promote this video, and obviously it'll be in our YouTube channel, we'll send out an email, and in those correspondence, we'll make sure that we have Cortney's contact information, and more importantly, phone number, link to schedule on your calendar. I'm sure will be part of that. Yep. As always, any questions, feel free to reach out to us. Or reach out to the information we put for Cortney, get on the schedule. And I say, well, we're going to get through this. It's going to be, and I think we wanted to get ahead of I think it's going to be hyped quite a bit in the media. And I think there's going to be a lot of events, a lot of agents, insurance agents, that may get people whipped up into a frenzy. We're trying to front run that, educate people so they don't have to get too excited about it. It's changing. It's an easy fix if you go through a great process. And like I say, some people are going to be great. Some people may want to make a change. Beyond that, we probably don't need to make it that much bigger of a deal.
No, and I don't want this to all be doom and gloom either on the plans. I was at a carrier rollout yesterday with Aetna and today with Blue Cross and Blue Shield, and they both have very robust plans and pricing looks good. So it's not all bad so far what we're seeing, and we're just starting to see those carriers with their rollouts of their products for 2025. But the reality of the situation with the good that they're adding, they are taking some things away. So again, just because the plan you're on this year is great, good chance it's changing for next year. However, we can find you something equally as good. It will just require a change. So things are things are definitely still really good on plans. These Medicare plans become more and more robust. The longer I'm in this industry, I'm continuously impressed. There are some things that we don't like, some changes that we don't love, but also some changes that are going to be really great for some beneficiaries out there. But you won't know until you can look at them all, and we can sit down and show you some different options.
All right. That sounds great. Well, everybody, we appreciate your time today. We'll keep you up to date. And like I say, reach out to Cortney if you get a chance. And as always, if you need anything from us, feel free to give us a call or send us an email.
Investment advisory services offered through Elevated Capital Advisors, LLC, an SEC-registered investment advisor.